And we are recording live with Dr. Caldwell Esselstyn as we get ready to start the Lillian McDermott radio show.
The Lillian McDermott Show.
Time to dance, Dr. Caldwell.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be. I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friend. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are new to the Lillian McDermott radio show, the purpose of the show is to provide a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening friend, will feel empowered to live the life of your dreams and embrace a new truth. And for those of you who are listening today for the first time, I'm going to ask you to speed dial my number, 407-373-5959, because we are giving away 2 gift cards, one for the First Coast in Jacksonville, because Native Son in Jacksonville is giving a $20 gift card, and so is Sunseed Co-op, $20 to start your new life with nutrition and eating well and healthy. And so at the end of the show, the first caller at 407-373-5959 will get their free gift card from both. They both are all organic, non-GMO. So I want to encourage you to begin your journey today. Now, as you know, I have been talking about Forks Over Knife documentary for the last 5 years. I have watched that movie so many times. I actually sit with people and watch it with them because it changed my life. Dr. Caldwell Esselstyn was featured in this documentary, and just recently, the other documentary that I am just obsessed over is Eating You Alive, and there he was, all handsome as he normally is. And so he has been responsible for so many people changing their life, reversing, preventing heart disease, all kinds of diseases. And so these are people that were sent home to die. Just right up, get your affairs ready, they were all told. And Dr. Caldwell Esselstyn said, give me these dead men walking because I'm going to take care of them. I'm going to teach them how to eat a whole food plant-based diet. And I am thrilled because Dr. Esselstyn, who has mentored many of the whole food plant-based community, is here because it is our sole purpose in life to give and receive love and knowledge. And I'm grateful that Dr. Caldwell Esselstyn is here with us. Thank you, Dr. Esselstyn, for changing so many lives.
Lily, I want to say thank you for this opportunity to be with you again. I look forward to our discussion.
Well, Dr. Esselstyn, you have a beautiful farm. You grew up in a farm since 1675. Your family has owned this farm. And so this farm was full of cattle, wasn't it?
Well, in the first several hundred years, it was the typical farm where it raised crops, and it also raised livestock, and there was a dairy. It was pretty darn typical, but that all changed in 1878 when my grandfather, actually he took one day off of school in the village, and he took the horse and buggy and he went to the village of Hudson, New York, which is right on the Hudson River.
Mm-hmm.
And he took the Hudson River Day line up to Albany, where he entered the state geometry contest.
Yeah.
And of all things, he won. And the result was he got a scholarship to Yale. So it was the first time that an Esselstyn went off the farm.
Wow.
He went to Yale, and he was a salutatorian of his class, and he became a lawyer. Then his son, my father, became a physician, but they always sort of hung on to the farm, and that's where I grew up.
That's beautiful. It's a beautiful farm, and you just did plant stock. But share a little bit about where your passion for nutrition, how that ignited in you.
Well, I went through medical school and then postgraduate training as a surgeon. My idea was that if you got a disease, we'll do surgery. We'll take care of it. We'll fix it that way. Well, it became increasingly apparent to me that no matter how many women I was doing breast surgery for breast cancer, I was doing absolutely nothing for the next unsuspecting victim. And this was about 1979, 1980, that I got so disenchanted with this that I began this bit of global research. And it was quite powerful to look at certain cultures in this global research where breast cancer was really 30 or 40 times less frequent than the United States.
Mm.
If you looked at breast cancer in rural Japan in the 1950s, breast cancer was very rarely identified. And yet as soon as the Japanese women would migrate to the United States, by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart.
Yes, and we're going to continue this conversation, Dr. Esselstyn, because we're going to hit the break, but we're going to continue this conversation with Dr. Esselstyn when we return worldwide at whenyounneedafriend.com. Be ready with your speed dials because you're going to win a prize. We'll be right here waiting for you. Now, keep an eye on the clock right there on the side, Dr. Esselstyn. Are you seeing the notes? Don't? Okay, so. Okay.
You can count on
Here we go.
me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
And welcome back to the Lillian McDermott Radio Show, where we always learn from one another. And today's teacher is, okay, so I would compare him to the Wizard of Oz. He is the one that we all turn to when we want to learn about a whole food, plant-based diet. All the doctors that we've had on the show that have been found from the documentary Eating You Alive, I've reached out to almost every one of them, and every single one of them says, Dr. Esselstyn is my mentor. Dr. Esselstyn is my mentor. Well, he's here to mentor us today, and he's going to teach us. He will teach us about the whole food plant-based diet. And to help you, my listening friend, with this journey, we have 2 gift cards, one for the First Coast and the other one for the Space and Treasure Coast. So Native Sun in Jacksonville has 3 locations, Mandarin, Bay Meadows, and Jacksonville Beach. They're giving a $20 gift card, as well as Sunseed Co-op. They're going to be giving also, they're both all organic, all non-GMO. So Dr. Esselstyn, have you always eaten a whole food plant-based diet? So you were telling your story about how you started researching how to help women once you had surgery for that they had breast cancer.
Yes, that's really it all changed, because when I recognized that here were these cultures that were plant-based, where breast cancer was very infrequently identified, and perhaps even more powerful if you looked at something like cancer of the prostate. In the entire nation of Japan, in 1958, how many autopsy-proven documented cases of prostate cancer were there? 18 in the entire nation.
Wow.
By 1978, they were up to 137, which still pales in comparison to the 28,000 who will die this year in this country. So somewhere along the line there, it became apparent to me that there would perhaps be more bang for the buck if we could look at the leading killer of women and men in Western civilization, namely cardiovascular disease, because as part of this global review, it was apparent that there were many cultures where cardiovascular disease was virtually unheard of.
Yeah.
And therefore, I guess the dream was this: if we could show people how to eat to eliminate cardiovascular disease, they would at the same time be greatly lessening the likelihood that they would ever have cancer of the breast, prostate, colon, and perhaps pancreatic.
Sure.
So that was the era where I looked at Ann and I said, you know, before we do this with patients, we've got to do this ourselves. And I knew I was going to do it, but let's be honest about it. I was brought up on an Aberdeen Angus beef farm and a dairy farm, and I was a cholesterolholic. So I knew I was going to do this, but I didn't quite know where. And finally, April of 1984, I was at a surgical meeting in New Haven, Connecticut with Ann. And gosh, the papers were so boring and the weather was just terrible. But they always have a banquet at these places. And at the banquet, a waitress put a plate of roast beef in front of me. And the roast beef was so enormous, it was draped over the sides. And I just took one look at it and I said, this is it. And Ann looked at me and she said, you're not going to eat your roast beef? I said, no. She said, well, then I'll have it. But interesting, Ann's mother had died at age 52 of breast cancer, and her sister, 2 weeks after that meeting, came down with breast cancer. And then she looked at me and said, I'm with you. So from April of 1984 until about June of 85, we very aggressively changed our whole nutrition foundation to plant-based. And by then I pretty well felt confident how to do this. And I went to our head of the Department of Cardiology and asked if I could have about 24 patients, which was the limit that I could have and still carry out my surgical responsibilities. And these people were, as you mentioned earlier, they were the walking dead. They failed their first or second bypass, they'd failed their first or second angioplasty, or they were too sick for these procedures, or they had refused. And there were 5 who were told by their expert cardiologists they wouldn't live out the year. And those 5 all made it close to 20 years. And we began to see some very exciting things. Not only was the disease stopping, but when we carefully studied them, they were reversing their disease. And this was very exciting. And so that's the story on my transition.
You know, it's amazing though, because when you're talking about these people, you went from breast cancer and getting women doing whatever you needed to do to remove the cancer out of their breast, but then you transitioned to cardiology. You're not a cardiologist, you're a surgeon. So how did you make that transition so seamless?
Well, I was still carrying on all of my surgical responsibilities, but I was seeing these patients, this first group, every 2 weeks in the office. Now, my concern was this, that the rock upon which this study would most likely flounder would be the lack of patient compliance. And I was not a trained psychologist, but I decided I would use the same mantra for these patients that I had used for my cancer patients. And this was something I had learned years ago from a marvelous West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician.
Wow.
And I was seeing these people for the first 5 years, every 2 weeks, where I would go over every morsel they ate. We would check their cholesterol, their blood pressure, their weight. And then at the end of 5 years, I got courageous and stretched it out to once a month. And at the end of 10 years, which was making it now one of the longest studies of its type, they were pretty well on autopilot, and I was able to stretch it out to quarterly.
Wow.
And that was the first group. Now, after I retired from surgery in 2001, this was just too good to drop. The results were just too exciting. And so I have continued my research with these patients and expanded it. And I work now at the Cleveland Clinic Wellness Institute, where I carry on a monthly intensive counseling seminar for patients with cardiovascular illness.
That's wonderful. And so your mantra is, what was the mantra that you gave them? I'm not afraid to die. I'm not afraid for pain, or what was it?
No, the mantra that we learned from Bert Dunphy was that patients are not afraid to suffer.
Oh, okay.
Not afraid to die, but they are afraid.
Got it.
Abandoned. And that's why you never leave these people. You stick with them. You're always there for them. And this is what I thought was so important.
I understand. See, my mantra is, I am healthy, I am wealthy, I am wise, I am love. And so I thought that was the mantra that you're going to come up with. So I was like, I want to hear what this mantra is. Okay. So that was the undercurrent, that every single one of them was a fear. They had an abandonment fear, interestingly enough. So as you are diving into the surgery of repairing arteries, and you're realizing that people are not changing their lives. So you get these 24 people. Of the 24 people, did any of them walk away because their food was more important than their life?
Yeah, there were 6 of the 24 within the first 2 months. Nice guys. I just knew that they didn't grasp the concept of what we were after here. And they were kind of an interesting group, because I informed them within that first 2 or 3 months that, look, yeah, I'm sure you'll be. I had no money for this study. And so I released them full-time back to their expert cardiologist, which was mutually acceptable. And then, they became my sort of quasi-control group. The distance, I wanted to see how they were doing. And over 12 years, it's interesting to compare the two groups. The 6 that left, sadly, 2 of them died, and the other 4 had to have open heart bypass surgery again. On the other hand, the 18 that stayed with us, it was interesting to see in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, they had 49 coronary events of worsening disease. However, in the 12 years after they came out of our study, 17 of those 18 had no further events, but one little sheep, after 6 years, wandered from the flock, got into the French fries and the lamb chops.
Oh, no.
And had more angina, had to have the bypass. But I'm happy to say he's back with the flock, but proves the point that I was trying to make.
Very good. And so now here we are, all these years later. These were people sent home to die, but they lived, there's some of them are still alive now.
Some of them are, but much as I'd love to say I could make them eternal.
No, of course not. But you call.
Just recently, who were in their 90s, these were people that came to me when they were in their early 60s. After 30 years, Father Time caught up with them in their 90s, but they did not have a life where they were crippled at all. In other words, they had an abundant life filled with all the activities that one would expect, but they did not have to suffer from any chronic illness.
That's beautiful. And you call heart disease a toothless paper tiger.
Yeah. See, that the thing that's so fascinating about heart disease to me is that it's so shameful to think that in this country and in the West, we have made a $1 billion health industry around an illness that does not even exist in half the planet.
Mm.
In other words, a lot of people will want to refer to stress, their genes, but my friend, let's talk about it. Nothing trumps food. Heart disease is a toothless paper tiger that need never, ever exist. And if it does exist, it never, ever need progress. This is a benign foodborne illness.
Amazing. Amazing. And you know, the sad thing about this, Dr. Esselstyn, is that hardly anyone will announce this in the news. Hey, someone got better from eating a whole food plant-based diet. And not only that, reversed their heart disease, back from a break. You know, they don't do that. It's all about pushing the pill. And as you know, my registered service mark is you can take a pill or you can take responsibility. It's not that I am against pills, because sometimes you do need to take them short term. It's that I am for doing everything that you can do to live the life that you want. And we're going to continue our conversation with Dr. Caldwell Esselstyn Jr. when we return worldwide at whenyouneedafriend.com. We'll be right here waiting for you. So, Dr. Esselstyn, of those 18 that stayed with you, how many are alive today?
You know, I haven't had a chance to look up all of them again. I know that there are several who are alive. I know there are several who have died, but they don't seem to die of heart disease.
Yeah.
You know, pneumonia. Mostly that I'm aware of. No, there was one other interesting story. There was a gal, one of our women patients. She was wonderful, and the reason she decided to do our program was she felt that if she died, she couldn't stand the idea of her husband remarrying and having another woman.
Hey, whatever works, right, Dr. Esselstyn?
Couldn't stand another woman. Yeah, all the hard-earned rewards that she and her husband had worked for. So she outlived her husband, and by about 15 years. And when she was 91, and all of her friends had died, and here she was eating plant-based and doing well. And then somehow, in many of us, and it seems to be when people are quite elderly, sometimes I won't say they were going to give up, but she knew that she wasn't going to live much longer. And she went back and she said, I'm going to have chocolate cake. I'm going to have French fries. I'm going to have steak.
What is it about food? What is it?
She just, she really, in other words, she more rapidly ended her life on a note that she wanted to. But
it was kind of like suicide, huh?
Well, I don't think it.
But you're going to kill yourself.
But she knew that it wasn't going to help her.
Yeah.
But it was all right. And her sons, who were in touch with me, were very proud of their mom for what she had done for 30 years to stay afloat. And she was a wonderful example. She was in the film Forks Over Knives.
Oh, which one was she?
Evelyn.
She died.
She was the one that said, pay attention to Dr. Esselstyn because he can be a tough taskmaster.
Yes, I remember her. She was had weeks to live, didn't she?
Oh, no, well, yes, when we first saw her, she did. But
yeah, and she was a great spokesperson for you, that's for sure. But she lived 30 more years.
Yep.
And she didn't have any more bypass surgery or anything like that.
No, she was great.
Amazing. So when we come back, Dr. Esselstyn, let's talk about what happens. Why? Because you talked about cholesterol several times.
No, I think we'll talk about the disease mechanism if you want.
Yes. Okay. So the next segment, I will talk about my social media really quick, and then I'll bring you back in. I want people to know that this gift card exists, so that so many people are under the myth. I was told by a marathoner, they take vacations all the time, that she could not afford to eat organic. And I'm thinking, wait a minute. It costs a lot of money to join a marathon. I mean, people can run and do whatever they want.
Should I be looking at you when I'm talking, or should I look at the screen, or can I look wherever I want to look? Or what's best?
Where is your camera? See, my camera is right here. I know exactly where my camera.
You are right in front of me, and then up above, I see two small.
Yeah, it all depends where you feel comfortable looking. Like right now, I'm looking straight into the camera. Right now, I'm looking at your picture. Do you see the difference?
Yep.
So I'm looking up at the camera, looking at you at the picture. Does it look any different?
No, not too much.
Okay, so just don't worry about it. And but anyway, yeah, I do want to talk about why food is so important and why we sabotage ourselves the way we do. So we'll be back.
Count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again.
And welcome back to the Lillian McDermott Radio Show, where you can hear us worldwide at whenyouneedafriend.com. I'm your host, Lillian McDermott, and it is my goal that we learn from each other. Go through life with childlike wonder. Pretend that you don't know anything, even if you have lots of degrees after your name. Because when you don't know what you don't know, how do you know that you don't know it, right? So the whole purpose in life is to learn every day, learn something new. And today, Dr. Caldwell Esselstyn is teaching us how to prevent and reverse heart disease. Prior to that, we just wanted to get to know him a little better, although he is a friend of the show. We love having him on the show, and we're hoping to get him back some more. And his son, Rip, who is another inspiration to a lot of people. Fruit doesn't fall that far from the tree. So I want to encourage you to go to whenyouneedafriend.com. This is where we have our responsibility conversations, where we learn we're taking 100% responsibility leads to empowerment and freedom. So go to whenyouneedafriend.com, become a subscriber, and wait for that confirmation email, because when you confirm, you'll get access to my Mind, Body, Spirit Positive Affirmation audio link and my 90-day challenge to self-love ebook. But that's not all. Go check out all the guests that we've had, all the teachers. One of them, Dr. Caldwell Esselstyn, has been on the show before, and you can learn and grow. Let's grow together. So let's grow on my Instagram, Twitter, and Facebook, on demand on Apple Podcasts and Google Play Music, iHeartRadio. And again, you can be the first caller after the show. Just set your calendar. If you go in and out, just set your calendar to give you an alarm at like 12:59 if you can. Oh, no, I'm sorry, 8:59 or 12:59, whatever it is that whatever time you're listening to. And if you're the first caller, 407-373-5959, you can start your journey with a $20 gift card from both Native Sun in Jacksonville or Sunseed Co-op in Cocoa Beach. So let's all make the choices that will lead us to the life of our dreams, the health of our dreams. So Dr. Esselstyn, we've been talking on the break, and those of you who would like to see him on YouTube, you can tune in later because the show will be on there. Let's talk about cholesterol and where the cholesterol, because we hear about all this cholesterol, bringing down cholesterol, and we've had experts come on the show say how important cholesterol is in our body. And so can you share how food impacts that cholesterol?
Yeah, I think that I'd like to discuss the mechanism of how where experts agree. Where does cardiovascular disease have its onset?
Okay.
Inception, its beginning. And that occurs when we all progressively injure the life jacket and the guardian of our blood vessel, which happens to be that delicate innermost lining called the endothelium.
Mm-hmm.
And the endothelium is quite magical because it produces this remarkable molecule of gas, nitric oxide, which is, believe it or not, the great salvation and protector of all of our blood vessels. Why? Because nitric oxide has a number of truly remarkable functions. For example, nitric oxide keeps all the cellular elements in our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, The arteries to your heart, to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide prevents the wall of the artery from becoming thickened, stiff, or inflamed. It protects us from getting high blood pressure or hypertension. Number 4, this is the absolute key. A safe and normal amount of nitric oxide will protect us from ever developing blockages or plaque.
Interesting.
Literally everybody on the planet who has cardiovascular disease has their disease because they have had decades of eating the wrong type of food that every time it passes their lips, they further decimate, trash, and injure the capacity of the endothelial cell to make nitric oxide. So when your nitric oxide gets so low that you can't prevent yourself from making these blockages or plaque. Now, the good news is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can get patients to get their arms around this concept and understand that they themselves created this illness by eating foods which injured their endothelial capacity to make nitric oxide, they can stop, and in my eyes, ever again, eating any of those foods that are going to further trash an endothelial system which is already a train wreck.
Mm-hmm.
Once they stop that, the endothelial cell recovers, makes enough nitric oxide so you can not only stop the disease, but often get disease reversal.
Amazing.
Now, what are the foods that every time they pass your lips, you do injure your endothelial cells?
Okay.
Any oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a bread, oil in a salad dressing. Oil injures endothelial cells. And
Wow.
so does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, and eggs. And anything that is dairy. Milk, cream, butter, cheese, ice cream and yogurt, and things like sugary drinks, Cokes, Pepsi, cake, pies, cookies, stevia, agave, and that's, in other words, an excess of sweets, an excess of maple syrup, molasses, and honey. And that pretty well covers the scene. Now you're going to say, well, wait a minute.
Yeah.
What am I going to eat? I'm going to eat all these marvelous whole grains for your cereal, bread, pasta, and rolls. 101 different types of beans and legumes and lentils. And this is especially important, all those marvelous red, yellow, and green leafy vegetables, white potatoes and sweet potatoes, and some fruit. And now there are many books, including our own, and with hundreds of delightful recipes surrounding that kind of food. And it's interesting that the first thing many people will say, where am I going to get my protein?
Mm-hmm.
A couple things. Have you ever heard of anybody going to an emergency room and saying, my God, help me out. I'm short on protein. There is protein throughout plant-based nutrition. There is protein in grains. There's protein in greens. There's protein in beans. You're just never going to be short on protein. As a matter of fact, increasingly in recent years, what we have noticed is that more and more athletes, even professional athletes, are turning to whole food plant-based nutrition. Why?
Mm-hmm.
Because not only do they have greater stamina, but their recovery time is much quicker. And the strongest man on the planet today, a German by the name of Babudian, who can lift 1,200 pounds, plant-based.
Interesting. So I want you to sing your song. I want you to get closer to the mic, Dr. Esselstyn, and sing your song that you do for the cruciferous greens.
I know, I will. just a moment, because I want to just emphasize one other point.
Okay.
This is something that we've added just in the last 6 years for patients who have cardiovascular disease, because I asked them, if you could imagine that your head could get inside those arteries in your heart, which are diseased, they would see that that disease is an absolute cauldron of oxidative inflammation. So we need antioxidants. No, do not go down to the health food store and buy a jug of pills that says antioxidant, because it doesn't work, probably going to be harmful. You're going to get your antioxidants from food, okay? What food? Food that is high in what we call ORAC value, ORAC, oxygen radical absorptive capacity. So this means if you're having raspberries, blueberries, strawberries, and blackberries on your oat cereal in the morning, terrific start. However, nothing can trump the antioxidant value of green leafy vegetables. I'll now ask these patients 6 times a day to chew a green leafy vegetable that is roughly the size of their fist after it has first been boiled in water 5.5 to 6 minutes or steamed. And then they must anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide.
Wow.
So they're going to chew this. They're going to chew this alongside their breakfast cereal, again as a mid-morning snack, again with their lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when they have that evening snack of kale. All day long, they are basking and they're bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidant. And you're going to say, well, wait a minute. What?
And we're gonna take a little break, Dr. Esselstyn, and we're gonna continue speaking with Dr. Esselstyn. He is just an amazing man. I hope you guys are listening really close and grow with us. We're gonna continue our conversation worldwide at whenyounneedafriend.com. We'll be right here waiting for you. Sorry, Dr. Esselstyn, we had to go on a break.
No, that was perfect. No, because I was just about to do my...
Yeah, your jingle. We're going to hear your jingle soon. Yeah. So okay, let's talk about oil. We have a lot of people. There is a book called Always Hungry. And she's someone that I've become friends with. And she and I were talking about how important oil is. She said the Mediterranean people, the Mediterranean diet consists of olive oil, and that oil is important for us. What do you say about that? What are your thoughts, and what does medical data show?
Well, I think it's very clear that by now, I think your audience understands the importance of nitric oxide.
Oh, yeah, that was great.
And I think one of the better studies in this regard was done by Robert Vogel, who was the former chairman of cardiology at the University of Maryland. And he did a test on healthy young subjects called the brachial artery tourniquet test. Mm-hmm. And the brachial artery tourniquet test is a test for the ability of the endothelial cells to make nitric oxide. And here's how it works. Mm-hmm. You take an ultrasound probe and place it over the brachial artery at your elbow. And there on the screen is a readout of the diameter of the artery. Then for 5 minutes, you encircle the upper arm with a blood pressure cuff that you inflate above systolic blood pressure, so that for 5 minutes you have absolutely zero blood flow to your forearm and hand. Then you release the cuff. Blood is restored, and you immediately take the ultrasound probe and once again measure the diameter of the brachial artery. And then the healthy individual, it'll be 30% greater because of all the outpouring of nitric oxide during that, as a result of that tourniquet time. And what he found was when he did the baseline with these subjects, and then when he fed them olive oil, there was a tremendous dysfunction of endothelium. In other words, it couldn't begin to approach what they did before they drank the olive oil. In other words, the olive oil compromised the ability of the endothelial cell to make nitric oxide. That's a pretty standard, well-accepted test. And there have been many others now that have done that in the experimental setting, showing again that olive oil compromises endothelial function. And it's been really remarkable when I think about how I treat people who are vegans who have heart disease.
Yeah.
And one of the first things you do is you get them to stop their oil.
Isn't that amazing? Isn't that amazing? Gosh. Here we go. Dr. Esselstyn, stay close to the mic, okay? Very close to the mic. This is our last segment.
I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
I am so excited that we have Dr. Caldwell Esselstyn on the show today. He is a mentor to many who have learned about a whole food, plant-based diet. Many of the doctors that come on the show quote Dr. Esselstyn, and it's the second time he's been on the show, and he's welcome back anytime he would like. This is very powerful information for those of you who think you're victim of your DNA. Think again. You're victims of, or you think you're victims, but what you are that you've given food and comfort a higher priority than your health. And so today, both Sunseed Co-op and Native Sun are offering $20 gift card. And if you want to be the first caller or texter, and I want to tell you that with Native Sun, they are giving 50% of the sales of Eternal Water, 50% is going to Hurricane Harvey relief efforts. So I just wanted to share that with you. These $20 is going to help you. For those of you who think you can't afford eating healthy, think again. Think of all the bills for medical bills that you pay, out-of-pocket expenses that you'd have to pay. That's expensive. And so this is an opportunity. After the show, be the first caller or texter, 407-373-5959, and win your free $20 gift card. First, Native Sun, Jacksonville, and on Sunseed Co-op. And so here we go. We've already, we just be the first caller after the show, okay? So here we go. Dr. Esselstyn, before we went on the break, you were talking about the foods to avoid. We all know this, but yet we are so compelled. I love keep it simple, the things that we cannot eat. So now you said that green leafy vegetables trump the antioxidant berries that are wonderful for our diet. So what are those? And sing it to me, baby.
The green leafy vegetables we like are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. Now, the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. Now, a couple of things that I think that I want to be sure to mention. How do you get patients to adhere?
Mm-hmm.
Patients to make this change? And I think the way that we do this now is I run this intensive counseling seminar, 5.5 hours. It's a single day because for patients to come to Cleveland, Ohio from California and Oregon or Washington, Texas, California, they can't come for days at a time.
Sure.
Therefore, we felt obligated to synthesize and put into a single day this package. And I think what happens is this. Patients are going to understand how they have created their illness and precisely how they can become empowered as the locus of control to halt and reverse their disease. And so it's so important for them to understand, if anything else, understand that they have got the disease because they have now so sufficiently trashed and injured their endothelial cell, they don't have enough nitric oxide to protect themselves. And so now we come to the areas where people can slip and slide. When they'll say something like, this little bit can't hurt. What are you talking about? I don't have a program that's 90% or 95%. Because think about it. If somebody tells me, Dr. Esselstyn, you'd be proud. I'm following your program 90%. That's nonsense. That's not my program. That means that 10% of the time, they are still destroying their endothelial capacity to make nitric oxide. They are not going to have a great result. Doesn't work that way. And we talk about, for instance, what are they going to, they'll say, well, Josh, what do I do when I go out to eat? And I said, well, let me make it clear. There are 4 reasons to go out to eat at a restaurant. 1 is you don't have to do the cooking. 2, you don't have to do the dishes. 3, the ambiance. 4, the companionship. But you never, ever go out to eat to further destroy more endothelial cells. I mean,
you've got a point there, Dr. Esselstyn.
Wait a minute. What do I do if I get asked to this house party? And my hostess has worked for 2 days to prepare all this great meal. I said, well, look, you've got to make a decision. If you understand exactly now how you got your disease by trashing your endothelial cells, you're going to look at the hostess and you're going to say, look, my husband and I, we have always loved Bill and yourself, and we appreciate the meal you've put on for us. But I am being cared for by this absolute monster from Cleveland. He won't even let me at your house have any of these wonderful foods. And so...
But isn't that a myth, Dr. Esselstyn, that we're giving up wonderful food? It's the mentality and the mindset that says that we're giving up. That right there is setting us up for failure. But what if we think about embracing health? Look at you. You're 83 years old. You would never know that. You're handsome, you're articulate, and you still have every brain cell intact.
Well, just one further point I wanted to share with you.
Okay.
About 1.5 years, 2 years ago, I was asked by the American College of Cardiology to join their nutrition committee. And I couldn't be prouder of what that committee is trying to do. Because right now, with all my good friends in cardiology, they are the first to admit that they never get any training in medical school about nutrition.
That's right.
They never get any training in their postgraduate years in nutrition. Mm-hmm. And so it's very hard for them to embrace anything other than all these drugs that they use for patients with heart disease. They're great for symptoms, but they have nothing to do with stopping the causation of the illness, nor do any of those procedures. And there's no question that a stent or a bypass can be absolutely life-saving when you're in the middle of a cardiac emergency or a heart attack.
Sure.
But when those procedures are done electively, there's no prolongation of life and there's no protection from a future heart attack. So one of the things that the Nutrition Committee of the American College of Cardiology is also looking at is how we can increase and improve the education of cardiologists in this venue.
Well, you're doing a great job, Dr. Esselstyn, and training a lot of these doctors. Every single one of them has come on the show, the ones that are whole food plant-based, and said, my mentor, Esselstyn. And, I know that we're going to reach out to Rip, your son. Fruit doesn't fall that far from the tree. Because we like to take so many shortcuts. I want to ask the question, and I'm hoping I know the answer. Is there any other way to get nitric oxide other than through a whole food plant-based diet through our leafy greens?
Well, there are going to be a number of products that you will see people trying to sell. Mm-hmm. But really, I think there are some very serious reservations that we have about that. The best way to do this is to restore the ability of your body to make nitric oxide. Now, there is one other wrinkle besides your endothelial cell making it, and that is this. And it goes hand in hand with the greens I was talked about, because think of it this way. if I can get you to chew a nitrate, and that's a green, the ones I mentioned.
And you boil it for 5.5 minutes?
I'm sorry?
You boil it for 5.5 minutes.
That's right.
Okay, I just want to confirm that.
When you chew this nitrate in your mouth, it mixes with the facultative anaerobic that reside in the crypts and grooves of your tongue. And those anaerobic bacteria reduce the nitrate in your mouth as you're chewing it to a nitrite. When you swallow the nitrite, it is further converted and reduced by your gastric acid to nitric oxide, which can now enter your nitric oxide pool. So you've got two ways of restoring your nitric oxide, through your endothelial cell or through your stomach, your gastrointestinal.
And we're going to continue, Dr. Esselstyn. After we say goodbye, I want to remind everybody to call 407-373-5959 to get your free gift card. And then we're going to continue, Dr. Esselstyn, after we're going to continue recording. And for those of you who want to tune in, go to whenyouneedafriend.com and click on YouTube video. Dr. Esselstyn, I am so grateful for you. And I'm going to be continuing to talk to you. You, my listening friend, I'll be right here waiting for you. This is Lillian McDermott wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Dr. Esselstyn, now we're off the air from the East Coast. You're going to be north, all the northeast, southeast Georgia, northeast of Florida, all the way down to West Palm Beach. Everybody's going to be listening to you on the radio. Now, we're going to convert. This is going to be, I want you to continue speaking what you were wanting to say because we have look at all the calls that are coming in because of you today. Look at that. Oh my gosh. We have so many callers that were listening to you. So I wanted to ask this because a lot of people want to take shortcuts, Dr. Esselstyn. They want to take shortcuts because we've been programmed to take a pill. And if we take a pill, somehow we can eat the way we want to eat. What do you say to people like that?
Well, the most common example of that would be people who take a cholesterol-lowering pill. Mm-hmm. And so what it does is it interrupts and interferes with the ability of your liver, which normally is making cholesterol, which we all need. And the idea that is if you just drive down your cholesterol with this pill, you're going to be protected from heart disease. Nothing is further from the truth. Mm-hmm. People with taking these statin drugs often continue to have their disease.
Yeah, and side effects.
Why? Because they are still eating the very foods that are injuring their endothelial capacity to make nitric oxide.
That's it. We get lulled into this.
Somehow, I know this isn't right in line with cardiac disease, but I want to say one thing. Mm-hmm. And it is so overwhelmingly apparent that this disease, heart disease, never has to occur.
Yeah.
Yet that is only a part of the seismic revolution in health that I see we are on the cusp of today. The reason that I'm still so involved in medicine and so passionate about it is that it's not only because we can absolutely annihilate cardiovascular disease, but at the same time, we see that diabetes goes away.
That's right.
That risk for stroke goes away.
Yeah.
Hypertension goes away. Obesity goes away. The risk of vascular dementia goes away. Mm-hmm. Even ulcerative colitis, Crohn's disease, rheumatoid arthritis, lupus, multiple sclerosis, allergies, asthma. I mean, the list goes on and on. And never before in medicine have we had anything that is so powerful. Now, the pharmaceutical companies hate this.
Yes.
But you're living into your senior years without Pharmageddon. You're doing it with plant-based food. You're absolutely destroying chronic disease. And this is never going to come about. This seismic revolution is never going to come about from a pill, a drug, or a procedure, or an operation. This seismic revolution in health will come about when we in the profession have the will and the grit and the determination to share with the public what is indeed the the lifestyle, and most particularly the nutritional literacy that will empower them to absolutely destroy chronic illness.
Now, I want a quick question. I appreciate your extra time that we're off the air recording this show. So I know we talk about nutrition and food, but how much, when you were going through all the people that you were mentoring many, many years ago, the 18 that you finally had the opportunity to watch blossom for the last 30 years, how much meditation and de-stressing your life, how much did you talk about water and sunlight and all of that? How much did that incorporate in your healing process?
Well, I'm going to be honest with you, as a surgeon and a basic vision of things as being pretty straightforward.
Mm-hmm.
I'm certainly totally a fan of those who people want to have relaxation, they want to have meditation. I think that is a exciting plus for them in their lives. But there are many people who just want to hear the message, what am I doing wrong that I can change? And when you think about it, for all those many societies who don't have cardiovascular disease, it's not because they're involved all day with mindfulness. I think it's wonderful if they want to enjoy it. But for some, it's somehow an extra burden, and it may be something that they find a little tougher to incorporate. Mm-hmm. And my good friend, Dean Ornish, who has...
oh, yeah, he's been on the show, too.
Done very well with this in his own life and in those that he has monitored. And Dean and I said a number of years ago, when I appreciated what he was doing and he was appreciating what I was doing, we agreed these are simply different ways up the mountain. And I think what is wonderful is, rather than get into a wrestling match between different, just identify which you're comfortable with.
Yeah. Okay.
One thing where we all are in agreement is in the fact that the food is so terribly important. And we've been very delighted to be a part of this.
Oh.
And I just think that it's so exciting to think that we and the nutrition committee of the American College of Cardiology are doing what we can to try to have the cardiovascular community begin to embrace what increasingly is the knowledge of how this disease develops. For instance, I was so proud and excited earlier this summer when, of all things, Harvard, in their marvelous studies of health professionals and nurses, followed for years, divided the results of how those persons were thriving in heart disease. And they had what they would call let's say it's a grade 1, excellent plant-based diet, grade 2, grade 3. They divided these sort of into quintiles, 4, 5. Obviously, who do you think had the least amount of any cardiovascular disease in their entire study? Yes,
I'm sure.
Those that had the closest to plant-based nutrition. So here finally we have Harvard on board, absolutely demonstrating over decades how powerful this can be. And the other smaller studies that have been done that clearly show not only can you take a population that doesn't have heart disease and keep it from getting it, but what is so exciting and embracing is that when you can take a group of patients who are literally absolutely seriously ill with cardiovascular disease, stop it. For instance, one of the things that makes, I think, our program so profound in terms of our counseling seminar that I conduct monthly is that near the end of the program, we have three representatives, 3 patients, 3 persons who 5-6 years ago were absolutely horribly ill with cardiovascular disease, strokes, heart disease, leg disease, tried all the procedures, all the drugs, all the operations. Finally, the white coats surrounded their bed and said, nothing further we can do for you. You have to just make it the best you can.
Mm-hmm.
Drugs. Bingo. Somehow they found out about our program, absolutely turned it around. And they both are so eloquent in how they present their story.
I'd love to have them on the show. We have a Thriving Thursday. These are people that are living the life of that they've made a change. Maybe they have seen hard times. And
wonderful.
Okay, well, do you think that they would be willing?
2 of them have been on national television.
Oh, which one? Which one?
Well, maybe you and I could talk privately about.
Oh yeah. Okay. Yeah. I'm sorry. I forgot I was recording. Okay. So, Dr. Esselstyn, I one last question before I shut down the recording. I would love for you to, like I said, many people are having a hard time with giving up the fact that we are not a victim of our DNA. They would, in order for them to embrace this, they're feeling they're giving up on this victimization that we've been taught and programmed to believe. How do you get your patients, because you had those 6 people that decided that they weren't going to be a part of your program. What was it about the 18? What was it that you saw what clicked in them that said, I am going to live a healthy life and I'm going to choose how I want to live by my actions first?
I think that there are several things. There is probably nothing quite as cherished as a person who enjoys excellent health. And these patients rapidly were aware how compromised their lives were because of their illness.
Mm-hmm.
It was compromising what they could do to them with themselves, physically and whatever. How it compromised their relationship with others around them. And they wanted to get that back. And increasingly, when they understand that this disease is not some phantom, that it's an illness that they themselves have produced.
Mm-hmm.
That is why I spend almost nowadays almost an hour on the endothelial cell and nitric oxide. I mean, you can kind of have fun with them. You can say to the group, we limit this usually no more than 10 or 12 patients. How many of you in the group, now that we've finished discussing the endothelial cell, have any questions about what has caused this illness?
Wow. Does anybody have the nerve to?
Anybody here, after they leave today, who dare tell me that they're ever going to have another food that is going to further injure their endothelium, no matter what the excuse? There is no excuse. We're not going to accept that. For instance, when I often will ask somebody when I first start seeing them, okay, how often do you eat out? Oh, not very often. And I'll say, well, do you mind if I repeat the question? How often do you eat out? Well, not more than a couple times a week. Fine. What are all those famous restaurants in Nashville known for the arrest and reversal of heart disease where you go to eat out? Oh, I didn't think of it that way. And I said, well, think of it this way. Every restaurant is going to have that oil. That oil is going to injure your endothelial cells. You doing this twice a week. That means 104 days out of 365, you are still endothelial cells and their ability to make nitric oxide. And that is not my program.
Yeah.
Okay.
And you convinced us. You convinced me. Dr. Esselstyn, I want to thank you. I want to say, on a personal note, you changed my life. Seriously, when I watched Forks Over Knives, something clicked in me and I've not turned back. Now, I must say, I am one that says I eat well 80% of the time. That other 20%, I guess now I can say I'm choosing
No,
to injure my endothelial wall.
no, those are people, if you don't want to have your heart attack when you're 40 or 50, you do it less. So you have your heart attack when you're 75 or 80. Or a little stroke.
You've convinced me.
There was a wonderful study out that showed, indeed, they looked at men and women who were aged 55 years, absolutely optimal risk factors, right? They followed them for 30 years. 40% of the men, 30% of the women came down with cardiovascular disease, even with optimal risk factors at 55. Okay, still, the American diet will get you sooner or later. Right?
No, you've convinced me today. Today, I'm starting my vacation tomorrow, and I need a little break because I've been, going back and forth to Jacksonville, and I live in Cape Canaveral, and going back and forth. And so today is my day where I get to step away for about a week and pamper myself. And I'm going to give it a lot of thought. You've changed my life again. So
well,
I am.
If you just looked at, and my daughter has done this when she gives her presentation, I'm going to say a plug for my daughter. She is the one who organized the first national conference on heart disease for women.
Wow.
It was kind of fun. But anyway, it's just so empowering to show people the avenue that they can have to being responsible so much for their health that they don't have to have it. I mean, my daughter has looked at the Esselstyn family history and my wife's family, the Cryles family history. We're no different than anybody else. You look at our uncles and aunts and parents and grandfathers, it is just ripped through with cardiovascular disease and cancer.
Yeah.
Right. Not a good way to have it happen. And to think that we can perhaps be instrumental in this, there's going to be so many more discoveries. But right now, this is the seismic revolution in health.
You know what? Just yesterday, I pre-recorded a show with Heather Dane, and we were talking about generational pattern shifters. You are a generational pattern shifter. You took what you were taught from birth, and you were able to shift it. And look at what you have given, what inheritance you have given to your children, grandchildren, and your future. You are an ancestral pattern shifter. And so I want to congratulate you for the work you've done. You've changed my life. I know that I talk about you all the time. So if your ears start burning early in the morning, it's because I'm talking about you. You have made an incredible change in the world, and I want to thank you from the bottom of my heart. I have some superheroes. Louise Hay is one of them. Wayne Dyer is another one. But when it comes to medicine, you are it. So I want to thank you, Dr. Esselstyn, for really changing the lifestyle and prolonging my life.
Lily, thank you so much this morning.
Thank you. And I'm going to thank you again, and thank you for watching. And we're going to turn off this recording.